हेलो स्टूडेंट्स। तो आज जो हम टॉपिक डिस्कस करने वाले हैं उसका नाम है एपिलेप्सी एंड ये एक इम्पॉर्टेंट टॉपिक है और एग्ज़ाम में भी पूछ सकते हैं। तो इस वीडियो में मैंने आपको इजी नोट्स प्रोवाइड किए हैं जिससे आपको कोई प्रॉब्लम ना आए। स्टार्ट करते हैं डेफिनेशन से। एपिलेप्सी इज़ द सडन एंड एबनॉर्मल एक्टिविटी इन द ब्रेन। देन सीजर्स, एपिलेप्सी को समझने के लिए सीजर्स को समझना इम्पॉर्टेंट है। सो सीजर्स, इट इज़ अ सिंगल एपिसोड्स ऑफ एबनॉर्मल एक्टिविटी और एबनॉर्मल मूवमेंट्स, ठीक है। देन एपिलेप्सी, इट इज़ अ ग्रुप ऑफ सिम्टम्स कैरेक्टराइज्ड बाय सीजर्स एंड लॉस ऑफ कॉन्शियसनेस. You can pick any one of these definition and we will see causes. First, instability of neuronal cell membrane. Second, first 6 months. In the first 6 months, the causes will be genital abnormalities, infections, metabolism error. Between 2 to 20 years, genetic factors, birth injuries, infections, trauma or head injury. Between 20 to 30 years, structural lesions, brain tumors or hematoma. Then after 50 years, the causes will be cerebrovascular lesion, metabolic brain tumors. Okay. Then pathophysiology. Before that, risk factors: head injury, infections, any occupying lesions, inflammatory problem, metabolic disturbance, overdose like lead poisoning. ठीक है. Then pathophysiology, specific cells generating abnormal electric activity called epileptogenic foci present in limbic center or cerebral cortex. So the cells electric activity of epileptogenic foci in limbic center or cerebral cortex, in that hyposensitive neurons in limbic center in hippocampus malfunctions. So whatever the hypersensitive cells or neurons are there, they malfunctions. The membrane of the cell become activated by certain conditions such as hypothermia, hypoxia, hypoglycemia, hyponatremia, sensory overload, certain phases of sleep. Okay. So these are some conditions that activated the cell membrane and cause malfunction or imbalance between the cell membrane. Then cell begins firing with increase in frequency and amplitude. It spread to adjacent neurons, then entire cerebral cortex, basal ganglia and thalamus and brainstem. Then it spread to the adjacent parts. Then the discharge in the brainstem causes muscle contraction and possibly loss of consciousness. Excitatory neurons eventually tries to inhibit neurons in cerebral cortex and interrupt seizures. So excitatory neurons inhibit hyposensitive neurons and interrupt seizure. Intermittent muscle contraction and relaxation causes epileptogenic neuron become exhausted. Inhibitory neurons tend to build up and seizures stop. So it is the pathophysiology of epilepsy. आज हम इस वीडियो में इतना ही डिस्कस करेंगे. नेक्स्ट वीडियो में हम डिस्कस करेंगे types, clinical manifestations and management and diagnosis. So thank you.